Hi there, this is Marielle Conception, your host of the My DPC Story podcast. Have you or someone you care about ever been burned by the U.S. healthcare system? If so, you are listening to the right video, because if you are listening, chances are the answer is yes. But the U.S. spends so much on healthcare. Why are so many Americans affected personally and especially financially by the healthcare system? Shouldn't that mean we have better healthcare access and treatment options? Shouldn't it be easy for us to be able to see our doctor when we need to instead of turning to the ER or urgent care? Historically, it's been seemingly impossible to answer these questions. But now that is changing through the direct primary care movement. This video that you have tuned into will bring you into the world of direct primary care and show you how physicians all over the country are changing the way they practice so patients from all backgrounds get the high quality care they need and deserve, which makes for both happy patients and physicians. Learn even more by subscribing to the My DPC Story YouTube channel. Find us on all major podcast platforms. Find us on socials at My DPC Story and at mydpcstory.com. There you can find resources including how to find a DPC doctor near you, conferences about DPC, DPC startup guides and advice, a store with DPC swag, and even a mapper showing where podcast guests are practicing. Thanks for tuning in to hear about this powerful movement. Now, on to the episode. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Thanks for tuning in, guys. Today is a very special extra episode of the podcast because I'm going to be talking with Courtney Sleypen, who is Senior Program Coordinator for the Division of Practice Advancement at the AAFP. And she and Bethany have been working together to bring this year's summit to fruition. And they are still working super, super hard at getting everything organized. So we have an amazing time. Courtney, thank you so much for joining me today and welcome to the podcast.
Excited. Yeah, thank you for inviting me. This is exciting. I don't know if I should admit this here to everyone, but this is actually the first time I've been a part of a podcast. So
wonderful. Well, I'm honored that this is your first experience on the airwaves, and what an experience to have it revolve around. So
yes,
the AAFP DPC Summit is going to be held between July 16th and 18th virtually this year. And I'm super excited, one, because it's the first official summit of the year, and two, because this is a time when everybody who is interested in DPC can come together at the same exact time. And even though we are not in person this year, we still can do networking around this event. So absolutely. Can you tell us about this year's summit and what we have to look forward to?
We've got 2.5 days jam-packed full of stuff. We're disappointed that we aren't going to be live. This is a really unique but fun group that, like you mentioned, really enjoys networking and being together. And so I think that means that next year live will be super fun. But we've got all sorts of things planned, really good sessions. We're bringing back the procedural workshops. That was a huge hit that we added in last year. We're going to have that. We're bringing back the student and resident track. Saturdays really kind of become our kind of nuts and bolts, and where we get into how you start a practice or how you can grow your practice. So lots of great information coming your way.
So let's hit this in more detail because I'm so excited just listening to you. So 2.5 days, we're starting on July 16th, which is Friday. And is there a pre-conference this time around?
So we are not going to do the pre-conference. We will still have the employer workshop. That will still be a part of the event. And then on Friday, so we'll start with just like some great general opening sessions, kind of just get everybody, hey, thank you for coming back. We're so excited that you're here. Let's kick this weekend off. And then we will have a morning procedural workshop. I believe OMT is in the morning. And then in the afternoon, we've got dermoscopy. Nick Thompson, Vance Lassie, which are two favorite physicians in this area, in this section, are going to be doing a skills hack. And then we've also got our student and resident track. So along with some other kind of sessions in there. So great Friday to get us started.
Learning about dermoscopy last year even though it was virtual, it was super high yield, and always Dr. Thompson, Dr. Lassie, just ridiculously helpful information and really encouraging to look upon your own skills and say, hey, I actually can do those things, right? So now I want to ask you, you mentioned OMT. Who is going to be doing the OMT procedure session?
Oh, you would ask me that. And I so hope that I do not butcher her name. Her name is Dr. Amy Kaposia. I think that is how you say it. So she is a DO physician that's going to be presenting that, and we're really excited to have her on board. And she's going to get into kind of, how you can implement that into your practice and basic skills kind of involved with the applications.
Awesome. Courtney, tell me more, please, about the resident and medical student focused track, because I know, having spoken with Ken Q about how he is moderating that part of the summit, that residents and medical students can attend for free. But how does that all work out in addition to the other presentations in the summit?
So there's a couple of different options. So the student and resident track will kick off on Friday, July 16th, and that is from 5 to 7 p.m. And it is free. If you want to attend just the student and resident track, that is free to students and residents. And then if they wish to attend the full event, there's a small fee that's associated for students and residents, but they can attend the whole session. But just that small student and resident track is free.
Courtney, I had seen on the website there are also scholarships. So how would it work if a medical student or resident was wanting to do the free track, the whole summit, and the scholarship? What would the process be?
So what we actually are asking them to do, if you're interested in attending that track, is to send an email to dpc@aafp.org. Let us know you're interested. And then what we're going to do is get you in touch with Dr. Kenneth Q, who's capturing the list. So apologies, the application period actually closed last week for the scholarship. However, good news, we received 34 applicants. I feel like the applicant pool continues to go up every year, which is really great. And I think that's one of the great things about being virtual, is that they have a little bit more flexibility to attend. And so we are currently working, all of those applications are being reviewed by the planning committee, and then we're going to notify 10 individuals they've won. They'll get free registration for the whole conference. And then of course we'll notify those that weren't selected. But we will continue to try to encourage donations to the scholarship fund. We have not dived into that pool in the last 2 years, so we've got a decent amount to really pave the way for hotel and travel costs in 2022. Fingers crossed that we're live, and then we can, pay the way for some to come in and attend the conference live. So,
and what is the cost per medical student or resident to attend?
The resident registration fee is $150. It's the same no matter when you register. And then for medical students, it's $50.
So Courtney, now on to Saturday. What can we expect for Saturday?
So Saturday, we will kick off with just some more general sessions. But Saturday is really where I feel like we get into kind of the meats and potatoes of the event. This is where we'll essentially break out into our starting a track or our growing a track. And so, for the most part, most of our attendance is coming to, they've either started transitioning or they're interested. But now we have this percentage of physicians that have been practicing in this model. And so we have started now providing this growing a practice track, which is kind of like, how can you add value? How How can you add to your patient panel? What about staffing your clinic or hiring more physicians? So a lot of really great topics there, and we'll get into that on Saturday.
Wonderful. And, ever since the tracks were added, I think that definitely brings value to the summit, because even if you've been to every single summit, there might be one piece of information, one person that you meet at the summit that could really change your outlook as to how you practice the next day you go, back to your clinic, or the next time you pick up a call with a patient. So that's awesome.
Yeah.
And then how about Sunday?
Okay, so Sunday is another jam-packed fun day. We are going to cover some of those not so fun, but really necessary topics like legal updates. We have Dr. Julie Gunther, who's going to be talking about how to add spark to your practice. And then we've got a really great panel about that encompasses integrative medicine. We've got a psychiatrist that's sitting on that panel. And then we're going to wrap it up with Dr. Haynes, and a panel we're really excited to be adding this year that's about breaking barriers and providing, just some culturally competent, inclusive care into your practice setting.
So important for physicians, especially after 2020, right? So
I agree 100%.
Courtney, thank you so much for going through the rundown of what to expect during the days. What can we expect when we attend the summit and we have technical issues?
Yep, really great question. So we have an FAQ page on the dpcsummit.org where we would encourage all of our attendees to go and make sure that they know how to check their connections and their internet speed. So to make sure that they're set up so that they can access the event and don't have issues streaming. And then all of our attendees will get access to the actual virtual platform a week before the event. And this is a time where we would really strongly encourage everybody to get in there, start customizing their profile, take a look at the program and start setting up your program schedule. But there is in there a comprehensive FAQ that On Services, our event production team, has put together. There's also some quick video tutorials that you can watch. You can test your mic and controls, and what they have, they call them like pre-event roundtable rooms. You can start to see who some of our exhibitors are and schedule one-on-one meetings with them if you want, or even with the faculty presenters. I think that's a really exciting feature. Those are some exciting features that we have that we didn't have last year. Yeah, and just really being able to, I think it will be kind of fun for the attendees to put together their profiles. Then during the actual live event, there's a help desk within the platform. And that's where that comprehensive FAQ is, the video tutorials. And then that's where you'll go during the event if you are having tech issues. We have somebody On Services has someone that will be on site to help answer questions that are coming in via email. If you're having issues like pre-event, then you'll want to send this to events@aafp.org, or you can always email dpc@aafp.org. So a few different, kind of depending on what your issues are. If they're tech during the event, we would encourage you to email via the platform, that help desk, but you can always email events@aafp.org or dpc@aafp.org.
Perfect. Thank you so much for
I know a lot of information.
Yeah, but I'll include this in the show notes as well, because it's just so crucial. Like, I remember for the most part, the help desk was insanely responsive and insanely helpful when I did have a couple of tech issues getting the volume to work. I remember that was my issue last year. But I feel that this idea that you guys are having a whole pre-week of getting your feet wet, so to speak, is really going to help reduce, hopefully, connection issues and just general questions about using tech if somebody has not attended the summit before, or it's been a year and they don't remember exactly what was their thing that was the problem that they had to troubleshoot last year. That's awesome. And when you talk about networking, in addition to meeting potentially the faculty who are presenting, the vendors in this pre-week, What about during the event? How is it set up in terms of networking events and meeting with vendors during the 16th through 18th?
So we do have specific times that are scheduled into the agenda for breaks, and we really encourage our attendees to go visit the exhibitor booth. We've got some of our, there will be some familiar faces, but we've also got some new exhibitors. So we're excited about that. But then there's also we have discussion boards. I think this is one of the great things about having access a week ahead. You can just get in and familiarize yourself with just the platform as a whole, so that once the event kicks off, people can start getting in, starting discussion boards, having conversations. Of course, like years past, we'll have the polls, whether or not sessions are live or pre-recorded. The faculty will be in the Q&A to answer any questions in real time. And then we also have, it's kind of one of the neat features about this platform that we're using this year is that an attendee can be watching a session with another attendee or exhibitor via a one-on-one video chat. So it's kind of cool. You can kind of explore and watch together. And then we also have this AI matchmaking, which is something we've been doing on the back end, is with all of our sessions and things we think the attendees might be looking, putting in keywords and things like that. So say, for instance, if you want to get in there a week ahead of time and start taking a look at the agenda and what sessions do I really want to attend, you can kind of be putting in keywords, and then things will pop up that, suggest to you that, oh, hey, you might want to attend this event because you put in this keyword. So that's
really cool. And yeah. Courtney, what about once people are in the event and they're attending a session, the session blew their minds, they heard Dr. Christina and Dr. Jake Much talk about Defiant DPC and how things are going 1 year later, and they want to connect with them. If somebody wants to connect with a physician who has presented, are there going to be clickable links in the bios, or how do we go about contacting one another after the summit?
Yep. So that page will exist. There will be a speaker page or a faculty page. I'm not sure exactly how On Services plans to identify that, clickable tab, but there will. And it will have headshots if we have headshots, and it will have bios if we have bios. It just kind of depends on whatever information our faculty provided to us. We could have Twitter handles in there, Instagrams, email addresses. So yes, there will definitely be a way to connect with faculty. Same sort of thing. If you go visit an exhibitor booth, all of that's going to be in there too. Faculty information will also be available on DPC website as well. So that'll be kind of in two different places, in case. I just want to kind of throw that out there, that we'll have the faculty information both on the dpcsummit.org and within the event platform.
Wonderful.
You can go and read about them. These are the things that they really wanted to highlight about themselves that they felt was, unique to them. And then also you'll be able to get contact information if you want to follow up with them during or after the event.
And Courtney, what I loved about last year's summit also was that if you were in attendance and you couldn't make a session for whatever reason, you could access the recordings afterwards. How is it going to be set up this year in terms of accessing the recordings or the sessions if you aren't able to attend in person, but you've paid your registration fees?
Yeah, we haven't quite worked out some of the specifics and the nuances, but yes, we will be recording all of these sessions will be recorded and available to attendees. We usually have about a month turnaround, and then anywhere from 6 months to a year that they'll be available. They will be free to those who, paid to attend. And then there is a fee for those maybe who didn't want to attend, but want to go back and purchase later. That'll be available. We're going to be providing that in what we kind of call, so we're applying for not only CME, but we're also going to be providing later on a self-study package. So yes, they will be available. We typically do a year, so I would imagine for probably a year after the event. And those are always uploaded onto the dpcsummit.org webpage.
For those people who, you mentioned the self-study package, will it be something where you can pick a la carte, like I really am interested in these sessions in particular, or will it be like this is the grow a practice track, this is the new to start a practice track? How will that work?
That's a great question. And this is new to both Bethany and I. So I don't have great specifics. But yes, I do think that we have some of those options, and we'll definitely probably take that into account and try to make that available like we do with the toolkit. We have really revamped that and updated it within the last few years and tried to make it so, okay, maybe I don't really need to know this piece, or I'm really curious about branding, or I have some questions about legislative issues. You can kind of pick and choose. Either I want the whole entire toolkit, or I just want these pieces.
And you mentioned CME. What type of CME can a person expect if they attend a part of the conference or the whole conference?
So we are currently working. We've submitted our application. So we're working to get our CME. We usually provide anywhere between 15 to 18 credits. 18 is kind of on the high. I would expect for it to be probably something like 15 to 16 credits. So yes, we plan to have CME as well. The student and resident track and then the employer workshop, those sessions won't have CME attached with them. But
thank you for clarifying that. I definitely was going to ask about the med students and residents portion. So thank you. I want to go back to registration now. What happens if you are not a member of the AAFP, or if you're not family medicine? What would you advise for those people who are not in one of those categories?
You do not have to be an AAFP member. Anybody can attend this. If you are having issues getting registered, we would just encourage you to reach out to the DPC web email address, dpc@aafp.org, and we can get you in touch with member services who can assist you with that. And then touching a little bit additionally on that, as part of kind of adding value to the summit, we continue to add some different sorts of topics. And I think for some of those that maybe, I think we've seen interest from like clinic staff. We've gotten inquiries from, physicians who've been encouraged to come, but they're like practicing psychiatrists. And I think that's one of the great thing about the panels that we have and the diversity amongst the faculty is that, we have in Dr. Sharon McCoy-George's panel session on Sunday. She specifically is talking about integrative medicine and different types of modalities that you can add into your practice. And so we do. We actually happen to have a practicing psychiatrist who takes more of a holistic, integrative approach. But she's going to be sitting on that panel and talking about herself and her practice and what she does. So I think that's one of the great things. I know we kind of tweaked our slogan a little bit this year, but that I think it resonates still. That the DPC Summit we've got a little bit of something for everybody. This really is about practicing on your terms. What do you want this to look like? And so we try to add a bunch of these different things, these nuts and bolts that are going to apply to the majority of our attendees, but then some other things that, kind of educate you on different ways to add value to your practice, or just to it really is about practicing on your own terms.
This is just super exciting because, previous guests on the podcast have included people who do primary care in the form of pediatrics, internal medicine, family medicine. And then also there have been specialists on the podcast as well who are looking to do direct specialty care or cash pay specialty care. So I love that, just like there is learning going on all the time from people listening to the podcast, from people going to Facebook groups, from people networking outside of the summit. I love that you guys have set it up so that anyone can attend, even if they are not an AAFP member or a family medicine doctor. And thank you. So DPC at aafp.org is who to contact if they're having issues with registration there.
Yes.
Courtney, after a person registers for the event, what can they expect to receive in their inbox and when before that pre-week of the summit?
So next steps, I don't know if the email is going to come directly from On Services or it's going to be from Swap Card. They're going to get an email. So essentially staff on the back end, we're going to take care of getting this list of registrants over to our platform production team, platform vendor, who will then get them registered, and then they'll get an email that will kind of essentially give them some login information. And so everybody will be registered within a week of the event. And And then that's really your time to kind of get in and start familiarizing yourself with the platform, make sure your internet speeds and your connection is good. But you will be receiving an email from our production team or platform vendor that will give you some kind of unique registration information. It's pretty intuitive, nothing overly complicated. But again, we have our events email and then our DPC Summit email. If you are having any issues, please just reach out to us and we're happy to follow up with you and make sure that you're getting access or answer whatever access questions you're having.
In terms of registration discounts, I want to ask because I had just learned that if you are a DPC Alliance member, you get $100 off. And are there any other discounts that are available for people to take advantage of with regards to registering for the event?
So if you are a member of either the FMEC, ACOFP, AAFP, or DPC Alliance, you do get a discount, and they should all have a code. And then it's really just a matter of, you got to get in before that June 21st date. That's kind of like our early bird registration. So would encourage everybody to, if you are interested, if you're thinking about this, we do offer a 1-day registration option. If you're kind of not sure, you could just, register for 1 day, kind of see what you think. And then if you really feel like this is a fit for you or you want to continue to explore it, then, call our events or email events, and then we'll get you registered for the rest of the event. But get in before that June 21st date so you can get that discount. It's $200 discount.
That's fantastic.
Or savings, yeah.
Savings. That is absolutely fantastic. And for people who are part of the, to access codes for those organizations that you mentioned, do physicians contact those respective organizations for the codes? Okay, wonderful.
Yep.
Thank you.
Yep.
And this is getting into the nitty gritty, but if somebody does attend 1 day of the event and they're like, oh my goodness, I've only listened to 3 lectures and I need to attend the rest of the summit, are you guys going to be open in terms of receiving calls during the weekend, or is it all through email that they contact you if they want to attend the full event?
We always have a hotline that's available especially for our events. So we should have somebody that's available, and I can follow up with you to make sure we kind of get that advertised so people know what number they can call. But then certainly we're going to have about 3 or 4 of us that will be checking the DPC email address. So if there's some questions in there, we can assist with that too. And we have an events team member who works closely with us on this event. And so she'll be with us that weekend too. And so she'll handle a lot of that kind of registration logistics. That always happens. It always happens. People always register at the last minute or decide they want to do the whole thing, or I can only attend 1 day. So do not fret. We'll have people on site to kind of help get you registered or answer any of those questions.
And I cannot even imagine the things that go into creating this awesome event. But I know, having seen Bethany the last time in person at the 2019 summit in Chicago, for anybody who has attended in person, we absolutely appreciate all the work that you guys put into this. And, I am really glad to hear that, you guys are going to be available in person. It reminds me so much of how Bethany was, helping everybody and anybody in person in the hallway outside of the 2019 summit rooms. But this is great, and I definitely would encourage people to take a really hard look at the agenda and see, if there's value, and the names of the folks who are presenting are on the agenda. So you can even potentially reach out to those people beforehand if you're not sure about, hey, is this going to bring me value, to maybe assess if you should attend the whole summit or not beforehand.
Speaker page should be available on the website, so you can start kind of digging a little bit deeper into the faculty and seeing if that kind of sparks some additional interest.
If you're a member of 2 organizations that you mentioned previously, could you do 2 codes, or is there only 1 code accepted at a time?
You are asking a really great question, and I don't do registration. I don't know anything about stacking codes. I do know that the codes have nothing to do with the June 21st deadline. So you can use those codes at any time and you'll get that discount. I don't know about stacking. I'll have to look into that. Just shoot us an email and we'll let you know about stacking codes. I wasn't prepared for that question about stacking codes, but I could see myself wanting to stack discount codes. So it's a fair question.
Awesome. And Courtney, are there any other important facts or features about the summit that we haven't touched on that you wanted to add today about what to expect at this year's AAFP DPC Summit?
I really think we've covered a lot. I think I just want to kind of reiterate that despite the fact that we are virtual, we have a really great weekend planned, a lot of really great sessions, really great faculty, a lot of great content and information. And we did not know what to expect in 2020, especially with COVID being very much at large. And our numbers were just as high. And so I think that just goes to show that the value is still here. This is information that if you are interested in DPC in any way, shape, or form, you're still going to come. And we're sad that we can't be in person, but I think there is still a lot of value here. And it'll be pretty similar to what you saw last year. And I think I think the thing that a lot of the docs are excited about is these clinical workshops. And so we were really excited to bring that last year, and we're excited to be able to do that again this year.
And you guys have so many moving parts that you guys are organizing. And again, I'm sure that everybody who attends the summit is just super grateful for all the hard work you put in. And thank you so much, Courtney, and an extended thank you to Bethany for all that you guys do. And thank you so much, Courtney, for joining us on the pod today.
Yeah, so fun to be here. Thank you for having me.
Coming to the pod tomorrow is Dr. Nasser Mohammed of Ulster Medical in San Francisco, California. This Tuesday, June 22nd, Dr. Rebecca Behrens and her virtual assistant, Angie Cortizo, will be talking all about virtual assistants in the direct primary care space during our next free fireside chat. Can't go? Ask your question you want answered on our SpeakPipe voicemail and hear your answer in the recording afterwards. Visit speakpipe.com/mydpcstory to leave your question. And I want to summarize the most important information Courtney shared with us today. All of the following and more is listed in the show notes. The AAFP DPC Summit will be held virtually from July 16th to 18th at dpcsummit.org. For general questions related to the summit, please email dpc@aafp.org. For medical students and residents interested in the free track, you can email the AAFP, as Courtney mentioned, but also Dr. Kenneth Q has created a direct registration form. The link to this form is in the show notes and on the resources tab at mydpcstory.com. Registration fees are $500 for members of the AAFP, $600 for non-members, $150 for residents, and $50 for medical students. There is a single-day access pass for $175, and the employer pre-conference only pass is $75. Early bird registration for those paying the member and non-member rates only needs to be in by this Monday, June 21st. The savings is $200 off registration fees. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends too. For more information on this episode and much more, please visit mydpcstory.com. Also, for the latest in DPC news, check out dpcnews.com. And a happy Father's Day to all of those who wear the father's hats out there. Until tomorrow, this is Marielle Conception.